Hello and welcome to the Healthy Lifestyle Conversations brought to you by Correct. I'm Izel Maden, your host and functional medicine certified health coach, joined by my amazing co-host and dear brother Eli, a certified health and life coach. Get ready for an inspiring and motivational journey filled with practical tools to guide you towards a healthier, happier version of yourself. Each week, we'll delve into science-backed, up-to-date information on nutrition, movement, sleep, breathing, relationships, stress management, and positive mindset. Throughout our conversations, you will discover how these lifestyle factors not only contribute to your well being, but also pave the way for a more meaningful, peaceful, and joyful life experience. So, whether you are tuning in during your morning routine or winding down in the evening, we are thrilled to have you with us. Let's embark on this transformative journey together. Hello, everyone. Hi, Eli. How are you today?
Hi there, how are you doing?
Fine, fine. A little bit feeling sick, all half the way. Less energy, but still keep going. How about you?
I've been traveling, as you know, so the jet lag I think is uh, quite settled now, so I'm back to normal. I had a good 2 weeks traveling, teaching, and also working a bit. Some new in my personal life. Quite nice, yeah. What's happening?
Great. Happy to hear. So, we will change the roles a little bit, and I will being more asking questions to you. So today we will talk about oral health and holistic dental care. So you are an expert in this, so it will be better that I will ask questions and you will give the answers. We will be happy to get also questions from our audience. If it's okay for you too, I would like to start with giving information about you. Eli has a Master of Science in Laser Dentistry from Germany and a PhD focused on gum health from Turkey. And also he's a passionate trainer and teacher of laser in dentistry for a decade, as he was last week traveling in this purpose. He was still traveling a lot, and he has a mission of touching 1 million lives through his teachings for the people to have a better experience and also better results in dental care. And last but not least, I would like to say that he has a special interest and also practice of sleep dentistry, which is about managing the sleep, the airways, and also snoring and sleep apnea with the use of laser technology. As long as I know him from my birth, as he is my brother and we grew up in the same house, I know that he's always passionate of technology and innovation, and I'm really happy to see him using this technology and teaching in his practice as a dentist. So Eli, welcome again. Let's start to our
Thank you very
episode
much.
for today.
Thank you. Few things led to each other, and I found myself really in a position where what I've been doing has a big impact on people's not just dental health or having a nice smile, aesthetics, but also I'm trying to have a system in place, actually an approach in place to help people to have better general health. So that has been really a big change from how things have been when I started my profession. That was in 2003. Especially moving to this country, it added a few layers. And just by luck, actually, doing what I thought was right led me to what I'm doing now, which we will be talking about probably a little bit more in detail, which is different than majority of how dentists look at their own profession, which is a little bit more localized to this area, which is the teeth and the mouth and maybe the lips.
Okay. First of all, I'm thinking about the oral health from my childhood where I was grown up. So I'm thinking about the main motivation was not having pain in my teeth or gums, and that was the motivation from I would say negative perspective, which motivates, yeah, because the pain, I guess all of us here and there experienced the pain of the teeth, which is it can be very problematic and painful. So this is a good motivation, but should be another motivation if we see our health in general to have a better oral health and dental care. You think?
Yes, so about the teeth, so what we normally tell our patients is just to look after or brush the teeth they want to keep. So that's definitely the case. It does start there, and then the issue is when the cleaning is not enough, then talking about starting from the gum perspective. So we would have some inflammation around the teeth, and the tissue around the teeth will be gums. And then having inflammation there means actually, as included in the definition of inflammation, usually, when you have an issue and you sprain your ankle, and when you have the swelling and edema, what happens is the space between the cells will get larger. So just like the inflammation that we mentioned also in the guts, it's exactly the same thing in the gums. And then that leads to bacteria to go into the tissue. And then there's all sorts of both inflammation issues and also there's infection issues because now the bacteria is inside. And then all those effects do not stay local. So the gum disease, which starts like this with the inflammation in the gums and the infection through the bacteria, is a level of inflammation which will affect cardiovascular situation, which is the heart and hypertension. It will affect possibly our lungs, our kidneys, and if the person is pregnant, it's associated with low birth weight of the baby and early birth. The bacteria that is causing the gum infection has also been found in the autopsy in the brain of people who had Alzheimer's. It seems like it's even could be causing that. Starting from there, again, it's a away from situation, but to stay away from these possible risks, we need to have the healthy gums. In addition to that, the other issue when the plaque, which accumulates on our teeth every time we eat or drink something sugary, which accumulates more bacteria, if that is not cleaned away, the other issue, of course, which will be causing the pain, would be to have caries and decay, a cavity in the tooth. And through that cavity, through that loss of that tooth structure, if the bacteria will reach the pulp, which is the inner layer in the tooth, which has the nerves and the vessels, then that will cause the death of the tooth, and that kind of tissue is great for bacterial growth. And then that's the situation where one would need maybe a root canal treatment, conventionally speaking.
Okay.
And that will cause inflammation and infection now going into the bone. So with the gum disease, it's going from outside inwards. When the infection goes into the tooth, then we get that going through the tooth to the tip of the root, and then it goes towards the bone. And then that will cause similar issues with inflammation. So these are two ways how we can have these interactions. So this is one thing about teeth and gums.
Okay.
The other, cleaning the teeth and around the gums. Other issues would be when the space and the jaws are not big enough and people have crowded teeth. So that could lead to the best, which could cause issues with the muscles, which are affecting the joints. All that would be connected to other muscle systems. While not providing enough space for the tongue. And due to the development issues where there is this crowded teeth situation, that would also lead to issues with airways, which means the person would not be breathing well, which leads to issues during sleep, like the snoring and other problems. So actually that physical situation where we have crowded teeth is not just aesthetically important, but it's about space for the tongue, for the airways, and that's a part of development. Additionally, obviously, there's social issues. So when we are not able to clean well, there is a bad smell, bleeding gums, and color changes in the gums, and all sorts of issues that could also cause aesthetic and social problems.
Yeah.
So these are just a few things, very basic things that are where we see dental and oral health being in relationship with general health. So this is the conventional or Western side of things. If you look a little bit more to Eastern Chinese medicine, and as we talk about the functional medicine side of things, there is also this kind of theory which is very well established in the Eastern medicine, as I mentioned, around energy flows and meridians, where different organs are related to each other, and these meridians through which energy flows for health could be blocked when there is an issue. If there's dead tissue, which is where the tooth itself is dead due to infection, that could also cause issues with other organs, and that includes almost all organs, depending on which tooth you're talking about. And that's the other thing you would want to remove, any blockage in energy flows. So that's the other side of the coin, which is really, really interesting.
So you are saying if we will take care of the cleaning of our mouth and the teeth, and eating the things that maybe less cause the damage to our structure and the teeth and gums, and causing less inflammation and infection. This is one thing that we can do, also not causing the blockages when the teeth is dead. So in the sense of crowded structure that may cause all sorts of problems like the breathing and the sleep problems, etc. What can I do by myself to improve these situations if I have it? Because snoring also can be very problematic.
As an adult, it's a bit difficult because it's more development, which means it's about the structures developing, not to the full potential. So as a child, while the child and the jaws are developing, there could be some exercises, and then maybe some orthodontic treatments, which will move the teeth around. And that could make space. So when I say exercises, it's mainly to do with the muscles. Because again, there's this theory where we say the muscles will actually shape the bones. So the amount of forces the tongue, the lips, and the cheek will apply onto the teeth from the inside and outside will determine where the teeth will stay within the mouth. So if what we call as tongue tie is causing the tongue not to be as mobile as it is supposed to be, so if it's not pushing enough from the inside, then the teeth will be inclined towards the inside, because the lips and the cheeks will push even with normal strength, because there is no resistance from inside. They will go inwards, which means the overall space is less, and you have crowded teeth, which means that there will be less space for the tongue to sit in the front, so then it could fall back into the airway. As an adult, there are some exercises, and all this is called myofunctional therapy. Myo means muscle function therapy, which is basically exercises. And actually there is one app people can use which is called Snort Gym, which provides some of these exercises, which will strengthen the airway muscles, improve the tongue posture, which is very important. So I can give you one interesting information around that is where the tongue is normally supposed to sit on the palate, on the roof of the mouth, even on rest.
Okay.
So many people will have the tongue sitting on the floor of the mouth, which makes the tongue much weaker and easier for it to go back into the airway. So you could work on the position of the tongue, the posture of the tongue, and use these exercises to strengthen the muscles. So that would be one thing. And sleep hygiene. So this is a little bit of a deeper topic. Maybe we can talk about it even next week. And then there will be things that we could help with, like orthodontic treatment, or there are some devices we can use, or laser therapy.
Thank you for the explanations. Actually, I was going to ask what is the right position of our tongue in our mouth that you would recommend for our audience. So you already answered that, which is in my life it's very critical because it's also I experience it at least that when my tongue is on the roof and not bottom side, it's also having a calming effect on my nervous system, so which also helps. So when I use also doing meditation, etc., or during the day, I'm trying to be mindful about the position of my tongue in my mouth. Thank you for that. I would like to ask, as we talked in the nutrition sense, from the gut microbiome, good bacteria and bad bacteria, and all the balance and how it's important. So I know from functional medicine that there is also oral microbiome. This is another group of microbes and bacteria there that are in our oral system. So do you have anything to say about that and why it may be critical for us?
As we know, the digestive system is a system from the mouth towards the anus. All that is very relevant, and it's a hot topic nowadays to even prescribe probiotics or general gum health and some other conditions. Very similarly, like we know about our skin and the gut, and so we have this oral microbiome, which is composed of different bacteria. The balance between types of bacteria will determine the health of the oral cavity. And that is why, again, very similar to the guts, eating healthy, nutritious food will help to prevent the unwanted bacteria to populate. And then that will prevent disease. On the other hand, obviously, too much sugar, especially simple sugar, and too often eating that kind of beverages or food will feed the bad kind of bacteria, and then the oral microbiome balance will be off, which then leads to disease, starting with the gums, but also that kind of bacteria might travel into the gut and into the body, because through inflammation it will go into the bloodstream and it might travel.
Great, thank you. It's really interesting for me learning about the microbiome and all around our body and its effects. We are hosting different populations on our body, which are helping us to stay healthy or causing us illness. So it's a better idea to learn about these. Another question for me is that I think a very popular topic, especially in the chronic health problems, it is recommended to check the metal fillings if people have. So this is a part of the traditional dentistry, I guess, having the metal filling in the past at least, still today maybe. Can you please explain what could be the problem if we have metal fillings in our body, in our teeth?
The initial thing we talked about is to do with one person needs to do about their own health, cleaning, staying away from bad kind of bacteria, not eating the bad type of bacteria. But now this is where we are talking about, fortunately, third parties placing some material as a part of very conventional, very old type of dentistry. The metal fillings, they would have mercury in them. So there is big discussion in the Western dentistry side about how much of that mercury is poisonous and how much of it goes into the body. So either you can discuss around that, and there are literatures, scientific articles to show both that it is very dangerously absorbed into the body, and there are some which will say no, that kind of mercury is not bioavailable, absorption will not be too much. I think there are two important things around that. One is the health of the gut. Maybe in a very healthy gut, as we discussed in the previous sessions, episodes, some toxins will not be absorbed by the gut anyway. That's a good situation to be in. But if there's any inflammation in the gut, obviously there will be more absorption. And the other option is obviously not to go into discussion and not to have any mercury in your body. So either way, I would suggest wherever possible not to have that kind of treatment. And that includes also some other materials that could be in other fillings, even tooth-colored fillings. And one very much discussed situation is the root canal treatment. So again, conventionally, this is a lifesaver for the tooth itself, because when we remove the infected inner tissue from the tooth and then have a filling in there. Again, conventionally speaking, reducing inflammation levels to a minimum, in some cases minimum, sometimes it's more, and then keeping the tooth there to function mechanically is a good success. A little bit more Eastern approach would say that kind of low grade, even symptom-free inflammation will contribute to all those other issues that we mentioned in the beginning. Heart issues, kidney, lungs, brain, and all kind of organs that will be affected by inflammation. They would say, no, let's not have that in the body, root canal treatment. Other discussion is around other metal commonly used is with dental implants, which is mainly would be titanium, but those implants are not purely titanium. There will be alloys, there will be other metals, including aluminum, for example. Again, there were two approaches to that. One could be to do a test like a ELISA test to see if the person is sensitive to those metals, or you could go with metal-free options and have ceramic or zirconia implants, for example, if you needed one.
Thank you. If I'm suspecting that I have a metal toxicity in my body, and then I understood that it is coming from maybe metal filling, can I take it out from my body? Who can do that?
Yes, so if it's already there, there is this protocol that's called the SMART protocol. This is to protect both the patient and the dentist from mercury vapor, because the highest amount of mercury released would be during placing the mercury filling and removing it. Release, as it is in the mouth, is much less compared to these two steps. Removing it, you would need a dentist who is familiar with this kind of safe removal, which will isolate the tooth, which will give you a mask so that you don't breathe in the air around where we are working with the mercury. It will give you the patient active carbon, which will bind mercury, and some other chemicals like glutathione, which will also bind the mercury if it goes into the bloodstream. That could be intravenous glutathione or oral glutathione. And the dentists will also wear some special masks to protect themselves.
Thank you. Last questions, which are maybe a bit more practical and from daily life. So we said that we need to brush our teeth, I guess at least twice a day, right? From my childhood, I remember it was 3 times.
Yes, twice a day, brushing the teeth with conventional brushes and cleaning in between the teeth with what we call interdental brushes is very important.
Flossing, or?
If you look at the back teeth especially, it's like having 5. So if you miss out the 2 surfaces that are looking towards the other teeth, that's 40%. So that's where most of the time the gum disease or even the cavities will start. It's very important to clean in between the teeth. Flossing is another debate. If you use it correctly, I believe sometimes it's really needed, especially if the spaces are really tight for interdental brushes. The main important thing is not to go too fast, especially if the teeth are quite tightly in contact. The floss will go a little with pores in between them, and then it might just cut into the gum. That's where you might cause inflammation and issues. If the person is really careful to get it in slowly, it could be used more safely.
And mouthwash, do you recommend to use?
The main cleaning is through, I would say, mechanical cleaning, or there is this option of oil pulling. So you could use pure coconut oil and swish it around the teeth, but that takes at least 20 minutes. So it may not be very practical for many people. So again, mechanical cleaning with a toothbrush that is not too firm and without too much forces onto the teeth and the gums will be the best. Mouthwash wise, there are chemicals in most of the mouthwash available in the market that we can prescribe. One that I prescribe would be a Blue M mouthwash, which has only activated oxygen, which kills the bad bacteria without any extra chemicals. But there are not so many in the market that could replace that. One important thing could be, I don't know if it was in your list of questions, fluoride, but it has the same discussion like mercury. And today we have the option to not go into the discussion and have other alternatives. And it's called hydroxyapatite toothpastes. So hydroxyapatite is the exact same chemical, natural chemical that we have in our teeth that make up the teeth structure. Nano-hydroxyapatite is better, but also hydroxyapatite toothpaste, which can be now found easily online and supermarkets, are better alternatives without the risk of toxicity that fluoride has.
I'm using for many years toothpaste that don't have fluoride, but also the natural chemical that you said, I'm not sure that they are inside, but there are also a lot of coconut including ingredients to the toothpaste. I think that I have a healthy teeth throughout the years, and at least I'm in a better place than my younger ages that I had bleedings, etc. Just having a natural ingredients toothpaste is good enough, or it's not the best case?
This fluoride or the hydroxyapatite is actually to recalcify, restructure the tooth if there's any tooth loss. So every time we eat anything sugary, including fruits and stuff, there will be some bacteria increase and they will create acidic side products which will soften the tooth. And then if you're brushing it, you could even lose that softened superficial layer. So this kind of material will recalcify, reharden the tooth. If you don't have that issue of having cavities, then this may not be crucial for you, and you will be brushing mainly to have also healthy gums. But if you have had cavities before, then you might be in a higher risk situation, and this will help you to reduce your risks to have cavities. This is in addition to cleaning, it's strengthening the weaker teeth. It's not crucial for everyone in that sense.
Yeah, I was going to ask about fluoride too, so thanks for answering that before I asked. Yeah, I think it's also fascinating to talk about all the issues and the topic of sleep quality and apnea or other snoring issues. I hope we will have another episode on that. But for today, I guess we had the general idea of oral health and why it's important, and a holistic way of looking to that also from Eastern world. So thank you very much for the comprehensive explanation. Do you have any final word our audience should know?
Maybe one thing around clenching and grinding teeth. That's another kind of stress which could be caused by psychological stress or wrong bites or some airway issues. And if people are finding themselves clenching and grinding their teeth, having some numbness and pain in the muscles in the morning, or some aching or pain in the joints, that's also another thing that should be looked after, because the damage done to the joints are very difficult to correct later on, and clenching and grinding are usually a sign of either, as I said, psychological stress, which should be targeted with stress management, and or it could be other things that the dentist could also help with. That increases the overall stress.
Thank you very much. It's really important. At least I know, because of my personal experience, that I had like clenching experience and I wasn't aware of it. I had headaches, chronic headaches, and I did a lot of things to deal with that, and it was always there. And then I remember I talked with you and Özge, Eli's wife, also dentists. They said maybe you are having a clenching at night or grinding. So after just they said it, I tried to have a more conscious about it before I was getting to sleep. I was checking myself, and then when I was waking up, I started to understand and feel that I feel the heaviness, and it was like it worked throughout the night. I said, there's a point there. And just being conscious about that, of course, I had maybe stressful life. I addressed them too, but not heavily. Mostly being conscious about the situation. I changed the situation throughout my sleep. And after a while, I didn't even pay attention to that, but I had the headaches. It was amazing, and thank you for that. Also reminding here, and still I don't have headaches. It can be really crucial just to being conscious about these topics and first of all learn about them. Thank you very much again.
Perfect.
As always, if you have any questions, we can take them. And if not, also afterwards, you can send us your questions through the Instagram and Facebook pages or acts. Eli, by the way, if the people want to have a dental care from you, where can they find you?
They can reach me on Instagram, Dr. Eli Maden, and then I can help them.
Great. Thank you very much. And to all audience, I hope you will have a great week, and we'll see you next week. Have a nice day. See you.
Thank you very much.
Hi there, I hope you enjoyed this episode. You can subscribe to our YouTube channel to access all of our episodes and receive notifications for new releases. Additionally, you can listen to our episodes on Spotify, Amazon Music, Castbox, and Apple Podcasts. To stay updated with more content from Core Acts, we invite you to follow our Instagram and Facebook pages. Feel free to save, like, and comment on your favorite episodes on your preferred platform. Lastly, we would deeply appreciate it if you could share and invite your loved ones to follow us on any platform convenient for them. This way, we can reach more people and contribute to elevating their health and life quality through healthy lifestyle changes. Thank you for your support.